Which of the following is a risk for preeclampsia? A. Diabetes. B. History of hypertension. C. Bromigravida. D. All of these. The answer is D. All of these. There are several risk factors for preeclampsia. These include history of hypertension, diabetes, older maternal age, first-time pregnancies, bromigravida, and pregnancies with twins or multiples. A labor and delivery nurse is assessing a newborn infant and notes that the infant appears to be jaundiced. What is a possible cause for this condition? A. The baby has been born HIV positive, as the mother was unable to afford HIV medications. B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving ROGAM during the pregnancy. C. The infant is experiencing fetal alcohol syndrome, as the mother admitted to utilizing drugs and alcohol throughout the pregnancy. D. The mother had gestational diabetes causing jaundice of the infant. E. The mother has exposed the infant to an active genital herpes outbreak. The answer is B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving ROGAM during the pregnancy. Jaundice of a newborn may be either pathologic or physiologic. Pathologic jaundice is usually the result of Rh incompatibility between the mother and the fetus. It occurs during a subsequent birth after the mother's blood has been exposed to the infant's blood during the first birth. ROGAM is given to the mother to prevent her immune system from attacking the second fetus, causing erythroblastosis fetalis and subsequent pathological jaundice. A labor and delivery nurse is monitoring a client in active labor after receiving epidural anesthetic. Upon assessing the client, she notes that the patient's blood pressure has fallen to 95/75 mm of mercury. The nurse's first action should be: A. Obtain an ECG. B. Give 1 mg epinephrine. C. Contact the physician immediately. D. Increase IV fluids. E. Place in semi-Fowler's position. The answer is D. Increase IV fluids. The first action should be to increase fluids, place on their left side and give oxygen. It is not necessary to contact the physician until all nursing interventions have failed. Epinephrine, a vasopressor, should be reserved for emergent situations only. A 26-year-old female bromigravida presents to the clinic to discuss her estimated date of birth, EDB. The nurse records the client's first day of her last menstrual period as February 28, 2015. What would be her EDB? A. December 6, 2015. B. December 5, 2015. C. November 5, 2015. D. December 7, 2015. E. November 28, 2015. The answer is B. December 5, 2015. The calculation of an estimated date of birth requires applying Nclex rule, where one's determining the first day of the client's last menstrual period, subtract 3 months and add 7 days and 1 year. The labor and delivery nurse is caring for a pregnant client that is experiencing contractions and has been on an external tokadynamometer to measure fetal heart tones as well as uterine contractions. The nurse notes that there are decreases in the fetal heart rate at different times of a contraction. The nurse is aware that this type of finding is consistent with variable decelerations, which are indicative of which of the following? and uteroplacental insufficiency. B. The effects of decreased pitocin infusion. C. A prolapsed umbilical cord or knuckle cord. D. The third stage of labor. E. Fetal head compression during contraction. The answer is C. A prolapsed umbilical cord or knuckle cord. Variable decelerations can occur at any time during a contraction, or without a contraction. They are caused by the umbilical cord that is prolapsed or wrapped around the fetal neck, also known as a knuckle cord. The compression of the cord can ultimately lead to fetal hypoxia, and therefore an intervention will be required to alleviate the compression.